Hello, I'm Dr. Apostolos Psychogios, and my patients often call me Dr. Paul. I attended medical school in Athens, Greece, knowing I wanted to help and heal my fellow citizens. As a medical doctor, I knew my destiny was to help with the diagnosis and treatment of people along their life journey. In Athens, the medical school curriculum was complicated and very advanced, somewhat longer than American medical schools. And while there was no formal training in genetics, I was trained in cardiology and later practiced in England and Scotland. When I came to the United States, I sought additional training in genetics with the intent of finding out how to cure diseases with genetic origins, completing my residency at Columbia University and my fellowship at Harvard. At the time, there were very few geneticists in the country, and the field was expanding rapidly. Just 25 years ago, the field of medical genetics was in its infancy, especially in cardiovascular genetics. I was working with prenatal, high risk pregnancies, and pediatric cases and detecting familial cancers in adults. I founded a new program and approach to genetic analysis and diagnosis at the University of Kentucky in what became a model of care for the university and for other genetic programs. My focus is not only on cardiovascular disease, but also hereditary cancer, neurological conditions, connective tissue disorders, renal disorders, undiagnosed conditions, medication response, and using precision medicine tools to diagnose and treat. My philosophy of care is to put patients and their families first as I seek to provide the highest levels of care in a very empathetic way. Genetics is the study of the individual, and that means my approach to diagnosis and treatment is tailored to the individual. Yes, we are all the same, but at the same time, we are not. There are so many differentiators, and it's my job to see patients as unique. I spend a lot of time with my patients, many of whom are undiagnosed until we come together or have very rare diseases. We discuss what's happening, and then I work with both the patient and their family to develop a diagnosis and a tailored plan of treatment. I was recruited to Providence in 2022 to help build out their genetics program with my expertise. I had many choices but chose to come to Providence because I was looking for the best program and practice, a change, and I wanted a happier life. I felt connected with the staff and leaders who are my colleagues. I also felt a very personal connection to the ministry of Providence. I am pleased that I'm able to practice genetics across the whole Providence system and impact many patients across Southern California. Lastly, Los Angeles reminds me a lot of Athens, with its diversity of people, climate, and attitude, and I feel deeply connected here to give my very best to my colleagues and patients in this unique program. Thank you.